filters. Welcome to the Ask the Expert Show with local celebrity host Steve-O. Sit back each week while Steve-O educates you with live in-studio experts, such as lawyers, doctors, home improvement, and financial experts in their field. Call in and have your questions answered each week at 888-565-1470. Now, here is Steve-O with today's expert in their field.
Hey, good afternoon. We are sitting here waiting for our guest to call in. It's a new show. We have a Dr. Michael Rodriguez. He is a plastic surgeon out of Fort Lauderdale, and he'll be on shortly. We're waiting for him to call in. Just a little bit about Ask the Experts. We give educational information from local professionals in the areas of legal, health, financial, and home improvement. We've got some new shows now. We've been doing this now for the last 3 years. We have a stem cell show coming on next month. And, of course, we have our public adjuster, which is so important now after this major storm we just had. We have our HOA, K. Bender Rimbaum. They've been with us for 4 years, so they do association law. We have a family law attorney, Tina Lewert. We also have a criminal attorney. These will all be coming up this coming month. We also have an immigration attorney out of Boca Raton, and we have an employment law attorney. If you're a doctor or a lawyer, or you work in the field of finance and you would like to come on and be interviewed on our show, you can give us a call at 954-336-3767. Today's show is going to be on plastic surgery. Dr. Rodriguez is considered one of the top plastic surgeons in all of South Florida. He has an office in Fort Lauderdale, and I believe he's in Davie as well. So we're just waiting for him to call right now. Again, if you have a business and you would like to come on Ask the Experts, we've been doing this now for a little over 4 years now. We've got a great audience, and our shows seem to really like it because they get a lot of calls from our show. I think the most important one could probably be right now after the storm is our public adjuster show, and they will be on with us next month. We have Dr. Michael Rodriguez on the phone with us now, and let's go to the phone. Hi, Dr. Rodriguez.
Hi, good afternoon.
Good. How are you?
Good afternoon.
Hey, you could have called us during surgery. I mean, we would have understood. I don't know if the patient would have, but anyhow, tell us, I've kind of told the people about you, but tell us about your practice.
So, Gentera is a interesting concept. There's been a lot of advances in what we call cellular therapy. And what that means is, we're using our own bodies to help repair our own wounds. And so, as we age, things break, just like a car or a refrigerator. And, it's not always easy to go and get a new part. So there's been massive advances in the way of stem cells, from our own body, and from plasma of our own body, and even fat from our own body. And depending, on what we do or how we use it, we can do it from anything from making patients feel better to perform better.
Wow.
Even longevity, vitality. I mean, also, so it's a very exciting aspect of medicine. Our baby boomers are very active group. It's no longer a rocking chair. In South Beach.
Yeah, I know.
It's golf commercials. It's erectile dysfunction commercials. It's living longer. And so, this is an exciting new phase for a group who's going to live, probably into the 80s, 90s, if not beyond. And when things start breaking, rather than, pull out a walker or cane, we can address the issue and have an improved quality of life, as well as the feeling of the quality of life.
So this is really true anti-aging.
This is definite anti-aging, right. I'm a cosmetic surgeon. However, I've always had an interest in this cellular-based therapy ever since way back in my training. My mentor was ahead of the game in this aspect. And so it was part of my fellowship project when I was training back in or out in the University of California, where a lot of these companies are based. And in conjunction with cosmetic surgery, some of the traditional techniques combined with some of the new refined, less invasive techniques, with the cellular-based therapy, I mean, it's really maximizing our results, maximizing longevity, and again, improving function and vitality.
Well, I've got Dr. Rodriguez. I have to ask you, so how safe is this? Because this is fairly new.
Cellular therapy is very safe. I mean, it's number one, it's your own body, so you're not worried about any sort of rejection, as you would, with some kind of transplant. We really haven't had any significant downside in terms of complications. There are different levels of efficacy, which means it just works better on some people than others.
I would think.
But in terms of safety, our staff, our staff is pretty well adept at the cellular-based therapy. We have a stem cell biologist who basically does all our protocols. We do our end. We perform these basically different studies to see how effective, what dosages, what kind of treatment arms, benefits patients for different indications. But for the most part, it's very safe. And again, looking forward to new applications which seem to be expanding every day.
Wow. So tell me some of the type cases you see that you can adapt stem cell to.
Oh, well, so right now, PRP and stem cell have actually already been well used in things like orthopedic applications. So we have Dr. Wilkerson, who's a board-certified orthopedic surgeon on staff, and he has done a number of stem cell extractions and injections into things like knees and elbows and shoulders. He's done this on professional athletes. The NFL and the NBA, these players are going to Europe, to get this kind of treatment. We are, which we're initiating through studies. And none of this is FDA approved, but, we're hoping that changes in the next few years. And as we conduct our studies to see what applications work best for what, we'll be able to expand on FDA indications. But for right now, I mean, it's already got excellent results for orthopedic applications, patients who recover from multiple traumatic injuries, also vitality, erectile dysfunction. These are all things that are working right now. It also has applications for skincare, hair regrowth.
Wow.
Again, erectile dysfunction, even vaginal rejuvenation. I mean, really, it's like asking yourself, what doesn't get old in your body?
Exactly.
And I'm sure in the future there will be some sort of application for stem cells or cellular therapy to be applied.
Well, I know we have a little bit older audience, so pain management is very important. So what kind of results are you getting with people having either knee or hip or shoulder pain?
We, in terms of discomfort or activity with it, or discomfort with activity, we've seen significant improvements. I mean, stem cells and PRP can sort of act like a hydraulic fluid on a joint that's where you have bone on bone or poor cartilage. And so, again, this has been sort of like a way to regain your function as opposed to live with your chronic pain while maintaining your activities. If you want to play golf, if you want to play tennis, if you want to walk around the beach and you got a pain, you might not be as apt to do it or as excited to do it or have to take some medications, and there's side effects, there's stomach discomfort from those medications. Whereas you do these stem cell-based applications, you can really get significant improvement, again, in the quality of life and function, not just for aging patients, but again, these are applications that are already being used in professional athletes.
Well, I know you said also about hair growth. What kind of results are you seeing with hair growth?
Well, with hair growth, hair transplant is probably still the mainstay of treatment. However, what's been pretty well supported by both data and evidence and the techniques is when you do these hair transplantations and add some PRP, which is your own plasma, you take your platelets and your plasma, you remove the red blood cells and the white blood cells, you can inject these directly into the scalp. You can do this, it maximizes the results of hair transplant. Additionally, many people are doing it as a form of maintenance of their hair loss, or to stop hair loss. So while you may not regrow new hair, you can use it as a maintenance treatment where you're taking your own plasma treatments or your own plasma from your own body with platelets, injecting it directly into the scalp. You can also combine these with, lasers, low-level light lasers to help improve the hair growth or the take of the graft in case of hair transplants. But again, I think the more time that goes on and the more studies, that are conducted, the more solid evidence we'll have. And I think, again, this will probably be, more and more mainstay of therapy than it is right now.
We're going to go to our break. First of all, give everybody your office phone number.
Sure. Our office is primarily located in Miami Beach. Our office phone number is area code 305-424-5775, or you can look us up at our website, www.gentera-med.com. That's GENTERA-MED.com.
Okay. Are you still there?
Yeah, I'm still here.
Okay. So we're going to go to break. When we come back, I've got to talk to you about cosmetic surgery, the procedures you perform.
Sure.
So we'll be right back with Dr. Michael Rodriguez.
Are you aiming for a refurbished, timeless look or to boost your appearance? South Florida's Dr. Michael Rodriguez provides the most up-to-date cosmetic procedures designed to bolster your regeneration and anti-aging, all while helping you feel better about you. Gentera Center for Regenerative Medicine and Dr. Rodriguez are focused on helping you restore your youth and beauty with a full menu of advanced cosmetic procedures that are proven to rejuvenate the face and body while reversing the effects of aging so you feel like a refreshed version of yourself. See why so many patients recommend Dr. Rodriguez to their friends and relatives. Call today to set up your consultation at 305-424-5775. Mention the Ask the Experts radio show and receive 15% off any of our services. To find out more about Gentera and Dr. Rodriguez, visit www.gentera-med.com.
And we're back. We're here with Dr. Michael Rodriguez. He does extensive work in stem cell, which we're going to learn a lot about stem cell over the next few months. But Dr. Michael Rodriguez is also a cosmetic surgeon. Now, you practice out of Miami, is that correct?
Correct. Miami and Fort Lauderdale.
And Fort Lauderdale, okay.
Correct.
So tell me the type of procedures you do as to cosmetic surgery.
Well, I guess one of the more popular procedures that are going on or increasing in popularity, especially in South Florida, is Brazilian butt lifts. And that's where we do, body contouring procedure and enhancement. It makes the backside look a little bit younger and fuller. In terms of, and that's in terms of body contouring. In terms of facial procedures or facial rejuvenation, it was pretty interesting. A couple years ago, chin implants gained a lot of popularity. Very high success rate for patients who are the right candidate. But other than that, it's really face and neck lifts are sort of the mainstay. Those have obviously developed and changed significantly since over the last 15, 20 years. And for me, continue to change, especially when we start to adopt some of this cellular-based therapy in conjunction or as an adjunct to our traditional surgical techniques.
Well, believe it or not, we just got a note here from a listener, and I guess they're interested in a facelift, but they said they do not want to look like Joan Rivers looked. Nothing against Joan Rivers, but I think I understand what she's saying. What would I mean when we would see Joan Rivers on TV? She had a hard time even smiling. Is that just from too much, or she was not a good candidate? You know, it was that look she had that her face wouldn't even move.
Yeah, I think there's probably several reasons for that. For me, you have to take into consideration that in many ways, you can't get everything back, and so I think if you go for swing for the fences, instead of the home run, you can get an out sort of thing. I think there's definitely too much of the wrong thing.
I understand.
The best part, or rather the best way to do really anything, but most importantly, facial rejuvenation, is that to do the right amount in the right place. And so what that means is, as we age, it's a three-dimensional process. We're talking about stem cells, to help band-aid multiple parts of the body, and that's because, we age all the way from our skin, and we're kind of like an onion in that we're built in layers. Our skin is not the same. Our fat is not the same. Our muscles can't do what they used to. Our bones get osteoporosis. Our glands don't work as much, which is why we don't have as much testosterone and growth hormone. And so our aging is essentially a three-dimensional. It's a three-dimensional process. And so for me, the best rejuvenation is when you're appropriately addressing all the layers that get older, that in effect contribute to the age appearance. And so what that means for me, in particular, to answer your question, Joan Rivers, I think she was probably a little overlifted, pulled a little bit too tight. In the back, back then they had aggressive chemical peels, which is why she had sort of that white mask look, so zero wrinkles on her. I think she was a little overpeeled, and also she was at the advent of Botox. And at first, Botox certainly works great. I think Botox was a little overused when it first came out, but now, there's more appropriate uses. For me, the best way facial rejuvenation should look is that nobody knows that you had it done.
Should look natural.
That's right. In fact, my promise to patients is, that you should be able to sit across a dinner table from somebody and they not know you had anything done. And I'm talking about full face neck lifts, up-rise, low-rise, cheeks, chin implants, brow lifts. You should be able to have all that done and the person sitting across from you not know you had anything done. The results should be subtle. People should be asking you if you changed your hair, if you lost some weight, if you're wearing a new makeup line. But nobody should be asking you who your surgeon is.
Well, we also had some other questions, and these must be from women thinking about getting a facelift or a breast augmentation, because one of them just asked us, how painful is breast augmentation? And I heard I cannot smoke within 2 weeks of the surgery.
I think, to go back to the pain, to go to your first question, breast augmentation, I think I would describe it as more sore,
okay,
painful. Implants, definitely they're stretching something out, and I think while it's stretching, you can feel tightness and soreness. I've done this on employees in the office, and if we do it on a Friday, they're expected to come back and work on Monday. So,
wow.
It's a minimal downtime. There is discomfort, there is soreness, but it shouldn't be an exaggerated downtime. It shouldn't be something that's not easily controlled with medications. And in fact, I routinely write for patients for 30 pills, or rather 30 tablets for pain control. Rarely do they get past, 8 or 10. And so what that means, and sometimes they just do it, anticipating they'll get pain, and they're not even really in pain. And so I would say breast augmentation for sure is not a significantly painful procedure. There's some soreness and there is recovery, but it's not significantly painful procedure. In terms of the second question, I'm sorry, what was the second?
It was about smoking. I know what
right. So
that has to do with breast augmentation.
Yeah, the whole premise of smoking is that as we smoke, we're taking in carbon monoxide. And carbon monoxide replaces oxygen. And so, as a consequence, you're in a low oxygen state when you're an active smoker. For me, that is very significant for patients who are going surgeries that have, what we call flaps or long incisions. What that means is the more incision you're making on somebody, for me, that's more wounds or more scarring that has to hide and heal well. There's some places in the body that I don't think smoking really has that much of an impact on your procedure. For instance, I think liposuction, you're using small holes or small incisions, and so you're not concerned about an unsightly scar because it's small. You don't have that much to heal. Tummy tucks or breast lifts, for instance, there's a lot of incisions and there's a lot of scars. And so, in fact, I want 4 weeks of no smoking. For patients who are undergoing face neck lifts, the face has such an excellent blood supply. With the newer techniques, and we get back to overdoing lifts, if you don't overdo it, you can still get an awesome face neck lift result that looks supernatural with incisions that are barely visible in somebody who smokes. And so I guess, the answer is it depends. It's not just if the patient is a smoker. Does the patient also have diabetes? Are they 60 years old or 20 years old? Is it a pack per day or just a few cigarettes a day? I mean, there's multiple, factors that go into smoking. There's no carte blanche, black or white answer. But for the most part, I do think smoking, not to get away, smoking is bad for your health. It's not good.
Right.
However, for cosmetic surgery, it really depends on the type of cosmetic surgery and the overall clinical picture of the patient.
Well, I wish you could see my cell phone right now because I am getting so many questions. Here's one. I'll bet you this is a very young person. What is the youngest you can be for breast augmentation?
For breast augmentation, so it depends on the type of implant. Right now, breast implants are only FDA approved for 18 years and older. If it's a saline implant, if your implant's going to be filled with saline water, if it's going to be filled with silicone, it's only FDA approved for 21 years and older. If you're doing it outside of these age groups, it's basically an off-label indication. What that means is you're using an FDA-approved device for an indication it was not necessarily approved for. That being said, we do this, when it makes sense, we do this all the time. Breast augmentation, however, in particularly in young girls, I usually don't do anything before the age of 18 years old.
Okay. Here's one. Do you do, never heard this, mommy makeovers?
Oh, yeah. Mommy makeovers for me is it's a procedure, constellation of procedures that we perform to help reverse the changes that occur to a woman's body from childbirth and pregnancy. And so most commonly it involves some sort of contouring, abdominal contouring, which can include tummy tuck and liposuction, or not always, and usually some sort of breast surgery.
So you can do several procedures at one time.
Correct. So you're addressing, there's a lot of stretching and engorgement of the breast glands from milk production. And, of course, when you're done with breastfeeding and as the gland involutes, your suspensory ligaments are stretched. And so it's not in the same position. It's not as high and perky as they used to be. So usually it means a breast lift. I also do breast lifts in conjunction with implants. And I think, basically it's a combination between some sort of abdominal contouring procedure with breast enhancement procedure is what we call our mommy makeovers. And yes, we can do these all at the same time. For me, again, it's based on the patient's individual clinical picture. However, I feel comfortable booking surgeries as long as I know that we're going to get things done in less than 5-6 hours. I don't like to keep a patient, on the table all day. And so usually what that means is we're able to get tummy tucks with liposuctions and breast lifts with implants. And that's about as much as we can do, but in terms of 1 day's time. But it really, in many ways, mommy makeover is one way to call it, but in many ways, they have a better body than before their babies. So mommy makeover, mommy enhancement, I think there's lots of ways to look at it. depending, again, on what the patient's individual needs are.
Listen, we only have a few more minutes. I got to ask this one, so it's a good follow-up. Do you do your procedures in the office or at a hospital?
I do procedures in my office. I do procedures in an ambulatory surgery center, and I do procedures in the hospital.
Okay.
And so it depends on the procedure. It depends on the patient. It also depends on anesthesia. I do the vast majority of my face and neck lifts on patients awake. And that is that I don't put patients to sleep. I give them a little bit of oral sedation in my office, and then I block everything just like the dentist does. It takes about 5 minutes. And then from there, we do a full face neck lift or full facial rejuvenation. So most of my office-based procedures are facial rejuvenation procedures. Ambulatory surgery center is reserved for patients where I'm putting patients to sleep.
Okay.
And that's usually, again, for these mommy makeovers or these body contouring procedures. And then finally, the hospital-based patients are patients who just maybe aren't the healthiest patients. It's reasonable to consider and moving forward with surgery as long as you have the right support for the patient should they need it. And so sometimes hospital-based patients many times are, most of these patients are ambulatory, and what that means is they have their surgery and they go home immediately after. Hospital-based patients, for the most part, are for some reason, should be observed overnight. And so that is when we're done with the surgery, they go through what's called a 23-hour observation, and that's usually based on some other medical condition that they have.
Dr. Rodriguez, give us your phone number. They'd like to call your office in the morning.
Sure. My phone number is area code 305-424-5775.
And I tell you what, you're going to be back with us again next month. I've got 12 questions here for next month. We had a lot of people having questions. Hey, great job today. We covered a lot of area. We're going to talk about stem cell again next month. And thanks so much for calling in.
Oh, my pleasure. Thanks for having me. I look forward to next month.
Well, thanks. It's Dr. Michael Rodriguez. We're going to go to break now, and when we come back, we're going to talk about back surgery. We'll be right back.
Are you aiming for a refurbished, timeless look or to boost your appearance? South Florida's Dr.